1988 was the last year the Center for Disease Control published AIDS to death cases. As we will see, the trend that over half of the cases of AIDS end in death. In this chart, of the 60,852 cases of AIDS, 34,088 died from it. In the AIDS community, according to a recent study of 5,246 obituaries in 16 homosexual newspapers from coast to coast, the average age of men dying from AIDS is 39. The average age of homosexuals dying from all other causes is even more revealing, 41. Only 1% die of old age. Less than 3% of all homosexuals surveyed are over the age of 55. People that regularly engage in sodomy live less than half their age. People who are casual with sodomy are susceptible to a breakdown of their immune system, causing various sicknesses and cancers. Once again, treating the symptoms and not the triggers to the syndrome. And it gets worse. As the immune system is destroyed, viruses can set in, commonly called HIV. Because of the time involved in the slow progression of symptoms, most people do not even know they are dying and spreading their deadly disease to the healthy population. An estimated 34 million people globally have been diagnosed with HIV, according to the World Health Organization. Since the epidemic began more than 30 years ago, the infection has claimed more than 33 million lives, the CDC estimates. More than 1.1 million people in the U.S. are living with the infection, but nearly 1 in 6 is unaware they are infected. This means that an estimated 916,000 people in the United States unknowingly have and are actively spreading HIV's pain, suffering, and death at your expense and risk. This chart illustrates that close to 60% of the professing gay men do not use a condom. Note the rate is rising. The chart does not include bisexual men. The medical care for these diseases are paid for ultimately by you, the taxpayer. AIDS, HIV are at your door. Here is a map of major infected HIV/AIDS people concentrations. Do you really want to spread it further in Minnesota? To stop it is your responsibility right now. If the promoters of the homosexual lifestyle could find any possible shred of evidence of gay behavior being justified as anything but a perversion of sexual lust, they would have paraded it with great fanfare and force unhindered law. On April 14, 2003, the International Human Genome Consortium announced the successful completion of the Human Genome Project. Educational institutions such as Baylor University, the Max Planck Institute, the Sanger Institute, Washington University in St. Louis, and others have spent countless hours and millions of research dollars analyzing these unique chromosomes. As the data began to pour in, they allowed scientists to construct gene maps using actual sequences from the Human Genome Project. And yet, neither the map for the X nor the Y chromosome contains any gay gene. Not even the Sanger Institute could throw enough money and experts at it to find anything. Remember, these are peer-reviewed publications. The human gene has been mapped hundreds of times in several people groups. No gay gene anywhere. Right now, all they have to justify sodomy is deception. There are numerous publications confirming the fact that there is no medical justification for the normal desire to sodomize someone. It is a voluntary act, and it is a choice. The person's thinking will voluntarily be reprogrammed to a deviant behavior as they submit to the hormone dopamine addiction. People really think they are expressing themselves when in reality the government has modified their behavior. Some more than others, but it's the same assault on the individual's behavior modification. Many other diseases are coming to the sodomite and is spreading to the unsuspecting healthy public at large. Staph typically breaks out in a cut or opening. However, these infections are originating in unbroken skin and are attacking uncommon places, including the butt, penis, scrotum, legs, hands, and face. The concern, according to Dr. Peter Ruin, an infectious disease specialist in Los Angeles, is that the disease could spread to the community at large. Large, painful skin infections started turning up early last fall among Los Angeles gay men, then appeared with increasing frequency. Because they still know so little about the extent of the outbreak, they cannot predict how many people it may eventually affect. The infection, which causes boils, deep abscesses, and widespread surrounding inflammation, has proved impervious to common antibiotics. But the infections in LA gay men, the majority with well-controlled HIV/AIDS, but many others in good health, took hold in unbroken skin. Federal figures show the percentage of staph specimens resistant to antibiotics increased from 2% in 1974 to 50% in 1997. The LA investigation has found the local strain resistant to current medicines. That limits the drug arsenal to less effective medicines, which is administered intravenously. Some doctors use the new antibiotic Zyvox, but with a single course costing $1,500, required for the rest of life, they often have trouble persuading insurers to pay for it. The sodomite lifestyle is a voluntarily slow, complicated suicide. This is a public health issue. It is avoidable, expensive, and you are paying for it, financially and with our children's lives. After comparing notes with several colleagues also seeing unusual skin infections in gay patients, Ruin said, "We felt we were looking at some form of outbreak." Ruin then notified county health officials. That's when the Federal Health Centers for Disease Control and Prevention reported the deaths of 4 children in Minnesota and North Dakota whose infections didn't respond to treatment. Similar outbreaks, sometimes with fatalities, have been recorded among intravenous drug abusers, athletes, prisoners, Native Americans, and Eskimos, whose close living conditions make them likely to share personal items such as towels. If people are telling you that gays cannot spread their diseases to you, better look at the real facts again that are not tainted with the gay agenda. "It's an evolving story," said Ruin, who in September began noticing an increased number of the aggressive staph infections in his gay patients. The aggressiveness of this took us aback. Not even the medical community for gays, bis, or straights can get this under control because it is voluntarily acquired and a physical system that cannot be controlled. Just abstain the behavior.